So in asking for referrals, there are some great scripts. We really very strongly believe in scripting, and I know all of you are interested in communication skills. That's why you came out tonight. So scripting is the kind of thing where people say, I want to learn how to communicate better, but I really don't want to use a script because it won't sound like me, or it's going to sound phony, or I can say it better myself. It's not really true. The reason why scripting is so important is because it sets the tone for the way that we do things. And if you go into a diner, for example, and you ask the waitress what the special is, and she says it's some kind of meat and a vegetable, it doesn't really sound as nice as when you go into a fine dining establishment and the waiter or waitress may describe to you in great detail how the chef pounds the filet or the veal, and the vegetables were, sauteed and seasoned and this and that and the other thing. It sets a completely different tone. So the other thing that happens with scripting when we allow people to put things in their own words is patients think we lie because they don't know anything about dentistry. So if a patient has an opportunity to come in contact with 4 or 5 people within one visit or a series of phone calls in a visit, and they often will ask the same question. Isn't that interesting how they keep asking the same questions to different people? That's because they don't really know, and they're number one trying to figure out what we're really saying, and they're trying to figure out if what we're saying is right for them. So when we speak in our own loose terms, we say it differently. Some people speak very technically. Some people speak really in lay terms. Some people can describe really on the patient level what we're talking about. However, what that says to the patient is, I asked 5 people the same question, and I got 5 totally different answers. It does not build trust. It undermines trust. So that's why having a playbook of scripts is so important, and it's essential to what we do. So a lot of what we're going to encourage you to do tonight is working off of scripts. Dr. Katz has described to you the script book that we have. Please, by all means, request it, take it, and use it. Everyone should be trained with the script so that no matter how many people a patient asks, they feel like they got exactly the same answer. And that says to them, I am in the hands of experts. I need this care. I want this care. This care is right for me. I'm going to do it.
And scripts are not just for team. Scripts are also for doctors. A little exercise or something to put on the action plan for all the doctors here is write down how to develop an elevator script. I'm sure all of us as the doctors have had situations where somebody asks us what we do, we say we're a dentist, and we get, ooh, or we get some sort of a funky comment. Well, develop a 20-second elevator script that paints your profession and what you do in a positive light. So a typical elevator script would be if somebody reacts saying, ooh, that must be very difficult, or it sounds messy, or whatever. Say, on the contrary, dentistry is so exciting. I'm thrilled to go to my office every day and create an environment where we can make positive change in people's lives and do it comfortably. Sometimes with them sedated so they don't even realize what they're doing, and they leave with a beautiful smile. It just makes me feel great. And just stop. They walk away from that saying, oh, never thought of dentistry in that light. I didn't realize it was something so positive. So the little things that we can do to change people's perceptions of what we do will have a positive impact on how these people seek care at a time when utilization of dental offices is struggling, to say the least.
Another action plan item, we want to encourage all of you to go with the team, work together, and come up with 25 most commonly asked questions in your practice. Now, for most of us, they're going to be the same. They're going to be, do you take my insurance? How much is whitening? Why do I need a crown? It doesn't hurt. Do I really need it? All of those questions. So you're going to come up with your 25 most asked, and then with some of the scripts that we're going to share with you tonight, you can apply those, and then you're going to work together as a team to come up with a consistent, powerful, positive answer for every question. Everyone needs to become an expert at answering those questions appropriately once the answers have been decided.
Another opportunity for scripting is taking patients on a tour of your office. And in that tour, making sure that everything you say is benefit-oriented. So that as you go through the office, you say, for your comfort, we do this. For your safety, we subscribe to all the sterilization requirements of the government. For your entertainment, we have DVDs or CDs, whatever. Patients don't hear a lot of what we say when we describe what we have. Remember, patients don't buy what you do, patients buy what you believe in. So if you give them the benefit, they are more likely to listen to what we do than if we just tell them what we do, because so much of what we have in our offices, the average patient views as threatening or something that's distasteful in one way or another. So if we paint the benefit first, they will listen to what we have.